Hey everybody, it's Dr. Matt Bridges, double board certified facial plastic surgeon from Richmond, Virginia. Today I want to talk about incision design for face and neck lift. You know, they always say the facelift result is only as good as the scars. It's true no matter how good the lift is, if the scars are pale and wide, or the earlobes are pulled down, or if the hair tuft in front of the ear is pulled way up, the result is compromised in my opinion. Now we love when patients agree to let us show their photos online, but we want patients to even be able to go to the hairdresser with no evidence that they had a facelift. We want patients to be able to have the surgery completely on the down low without any signs we were there. This starts with the design of the incisions. I typically start the incision at the edge of the hair in front of the ear. Since we get so much vertical lift with the deep plane procedure, if the incision extended straight into the hair of the temple like an older incision design, the entire hair tuft could be moved vertically even above the ear. This is one of the telltale signs of a facelift. The incision I make along the hairline is beveled, so it leaves hair follicles on the undersurface of the closure, which can allow hairs to grow through the incision after it heals. The incision then continues in front of the attachment of the ear to the face, and then usually behind the tragus, which is the little cartilage in front of the ear canal, and then around the earlobe, into the crease behind the ear, and then at the upper part of the ear it transitions to the hairline, which is hidden by the ear itself, and then down the hairline with the same beveled incision that we use in the front. This prevents any step off or irregularity of the hairline. Another very important contributor to incision healing is preventing any tension on the skin with the closure. With the deep plane technique, the skin just rides up with the deep plane with no tension on the skin itself. In fact, there's minimal tension even on the deep plane since it's completely released and repositioned as part of the dissection process. Because the skin stays attached to the deep plane, it also keeps its blood supply intact, which helps with faster, better healing as well. Here's a typical example of a patient who had a deep plane lower face and neck lift with the incisions as I described. You can see the nice improvement in her jawline, of course, but you also notice that her incisions are very hard to see, even when you look closely. If you'd like to learn more about this procedure or any of the other procedures we perform, check us out at MatthewBridgesMD.com and follow us on Facebook, Instagram, and now TikTok at MatthewBridgesMD. See you next time.